Thanks for staying with us. The lack of basic personal protective equipment, no insurance and non-payment of hazard allowances are some of the reasons members of the National Association of Resident Doctors of Nigeria have now downed tools at the Federal Medical Center Yenagoa in Bayelsa State. They spoke to TVC News after joining their colleagues in other states for the observance of the nationwide strike. Ovitime George has more.
Bayelsa has recorded 32 confirmed cases of the coronavirus and 3 deaths. 26 have been discharged, but 3 active cases are in the isolation center. At the Federal Medical Center, where there is an isolation center, these members of the National Association of Resident Doctors of Nigeria are not smiling at all. They agreed to down tools after what they call government's failure to meet their demands.
You will not believe it that we don't have basic protective equipment to protect us, especially during this period of pandemic. No life insurance. How can we be working and there's no guarantee of protection? A lot of our members have been infected. A lot of them have even died.
We should be employed at the correct grade level where other doctors are also being employed. We are also asking the state governments to implement the recently approved COVID-19 hazard allowance or the COVID-19 inducement allowance. And we have the biggest isolation center in the state. We have been working.
The safety and welfare of workers in the health sector sum up the major concern of the resident doctors at FMC Yenagoa.
This issue of strike ought not to have come on board. If government has showed some level of sincerity, because of our magnanimity, we've decided that the issue of isolation center should be treated, just to give room for government to dialogue. We hope and believe and pray that the issue of potential allocation of health will be improved. The issue of medical residency will be domesticated in this state because it is in tandem with the yearning aspiration of members. That when you're in training, which is just few, you should be well funded.
Good Nigerians, let us call our leaders. They provide us with basic protective equipment. I don't think that is too much to ask. That's what we are crying out. Let Nigerians begin to ask our leaders questions. We are tired of the promises that are not kept.
The services of doctors and other health workers are in higher demand as Nigeria experiences a spike in confirmed cases of the virus. It is most expedient for government and the National Association of Resident Doctors of Nigeria to meet at the negotiation table to end the impasse and save lives at a time of public health crisis. Ovitime George, TVC News, Yenagoa.